the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm happy to welcome Dr. Kristin MacDonald. Dr. MacDonald is a specialist in veterinary cardiology with VCA Animal Care Center of Sonoma County. Welcome, Kristin.
Hi, Marie.
How are you doing?
I'm great. It's pretty cool to have this wonderful opportunity through a podcast across the country. We can talk like you're in my office.
Well, I'm really excited. We're going to talk about the upcoming launch of State of the Heart. But before we get to that, can you tell me a little bit about your journey in veterinary medicine and with VCA?
I am delighted to. I started veterinary medicine when I was in utero.
That's true.
I was actually born when my dad was a senior vet student at Cornell. And I spent my summers hanging out in the clinic in Auburn University and checking things out and making friends. And, it was just part of my blood. I never really wanted to be anything else. It was it for me. I knew it. It was nice because I knew the direction I wanted to go, and I just needed to get there.
Excellent. Now, are you an Auburn grad?
I sure am.
War Eagle.
War Eagle. Yeah, undergrad and vet school, all at Auburn.
Oh, excellent. Me too.
And as far as VCA goes, I've been a part of VCA for a very long time too. I finished my residency at Davis and went on to, I found a very special hospital that really practiced high quality medicine with specialty and emergency. And both my husband and I are specialists. And so this was a home for us. And after several years, we merged with VCA, and we've been part of VCA, I think, since at least 18 years. And we were one of the first specialty hospitals in VCA. And I started there and never left because it worked for me and it was a great family.
Oh, that's wonderful. And I do have to say that your dad taught me dermatology at Auburn. He's one of my favorite people, so I just love him.
Yay, he was my teacher too. Which, no pressure. I worked really hard because nobody was going to say he gave me a grade.
Oh, excellent. So what drew you to the Specialty of Cardiology, and when did you make that decision, and how was the process of getting a residency?
So I didn't realize that I wanted cardiology until my internship because I sort of merged internal medicine and cardiology together as a student. We didn't have a cardiologist. And so I realized in retrospect, I wanted it all along because I would go in early and sign up for these cardiac cases so I could get them. And once I started my internship, I met George Eister, and he's one of the pioneers of cardiac surgery and vet medicine. And I was extremely excited about the field. And I love the fact that it's both medicine and some surgery. And I do like a little bit of excitement and intensity at times, and cardiac cases can bring that.
Yep.
From there, I was very fortunate that I could match on my first round with my top pick at UC Davis. And, I would suggest that if you're at a vet school with a cardiology service, you want to really make connections with them and look for opportunities that maybe you can be part of a research project and get on a paper and really make connections in the local area if you have a cardiologist. We love to have excited people that are looking to get into the field.
Excellent. And am I remembering correctly that you also did a PhD while you were at Davis?
Yes, I did. That's
you're
not necessary.
You're a smart cookie.
Well, I'm interested. That's what I would say. Yeah. I was interested. I wasn't sure if I wanted to teach or if I wanted to go into practice. And this PhD was a great opportunity at the time because was about cardiac MRI, which had not been done in
Wow.
cats of all things. And we had a great opportunity for funding, and I really was interested in the question of, what can we do for treatment in HCM? And so it gave me a nice opportunity. I didn't realize it was going to take that long, but it went by pretty quickly. And even though I went into, private cardiology practice, it gave me that background that I think has carried me through to be able to do projects like State of the Heart. And I still love to teach. And my teaching is actually to veterinarians in VCA now, or veterinarians across the world. So I still utilize those skills.
Walk me through the average day as a cardiologist, if there is such a thing.
Yes, there is an average day, and it's always really busy.
Okay.
Yeah, there's such a need for a cardiologist because there's so few of us around and so many cases out there that need help. So I'll often start actually the day before, the night before, prepping cases, new cases especially. With our WOOF software, I can read records, look at radiographs, and make sure I'm ready for the day. And then, I'll come in the morning, check in with my great team. I've got a team of multiple technicians and a service coordinator. And we have pharmacy technicians too. And so I'll check in with them and ask if there's any transfers overnight from emergency. And if that's happened, then we'll take care of them first and then just jump right in. Oftentimes, these guys have already been doing tech time appointments. They're moving things through. Then we'll start doing cases. We'll have new appointments and rechecks and, moving right through pretty efficiently with a good staff. And amongst this time, we might have the sheepish grin of an emergency vet come around the corner, looking with anticipation, asking, "Hey, can you help me out? I was wondering if you could look at these radiographs. What do you think I should do? Are you available?" Other times we'll have specialists come over saying, "I need to do an MRI on a dog and he's got a really big murmur. Can you help me?" So it's kind of doing some juggling with that as well as moving forward with all of the clients. And then we've got the phone calls of the dog that's maybe not doing so great, is coughing or is breathing harder. What should we do? And, it's trying to navigate how to help the client, whether it needs to be seen or whether we can adjust on the phone medications. And then really fast forward through to about after 5 o'clock, I'll start sitting down to really dig into the rest of all of those tasks that people or veterinarians are looking for some help and trying to make some phone calls and review all the labs that have come in. So typically, honestly, every day is very similar. And intermixed with that, you never know what intense emergency may be coming in that really takes top priority.
Yeah, it's a tremendous partnership. And having worked in positions where we've had cardiologists available for that consult on emergency and with specialty, it's such a tremendous benefit to patient care and what we can offer for our patients as they come in. You talked about your team. Tell me a little bit more about what a cardiology technician gets to do.
A lot. These technicians are really just no pun intended, the heart of the service. They are very hands-on. Day in and day out, they're doing blood pressures, often multiple times on a patient. They're taking really great quality radiographs. They're doing all the blood work. They're putting on Holter monitors. They're really good at getting a nice, concise history from the clients. And as they're doing these cases, they're also fielding client calls coming in. And so they really are essential. Of course, they're also holding for echocardiograms and, talking with clients about discharge instructions and all. So they're really often like the role of the veterinary student when we were on clinics. They train each other, so we have experienced technicians, and then we've taken on some newer members of the team. And so it's also helping to train their peers to become comfortable with it too.
I want to make sure as people listen to these that they recognize that it really does take an entire team to deliver great veterinary care, and the veterinarian and credentialed technicians and assistants and other members of the team to really, really focus in on that patient and what the patient needs.
I would actually also mention that that's the daily workings, but it gets even more particular when we talk about procedures. These are cardiac interventional procedures like putting in a pacemaker or pulmonic stenosis valvuloplasty or a patent ductus arteriosus occlusion. And this requires an even more skilled team. And, we rely upon a very skilled anesthesia technician to run these cases. And often there's two, as well as a cardiac cath technician that knows the names of all of these devices, has them all ready, and is ready to switch them out as we call for more.
Wow.
So we have a group of probably about 4 that are highly qualified and are able to be a part of these procedures. And again, without them, I couldn't do these procedures.
Yep, absolutely. What are some of the common heart diseases of dogs and cats?
The most common heart disease in dogs is mitral valve degeneration, and this is really very prevalent. About 10% of dogs out there have heart disease, and that's a lot of dogs. They'll often have a murmur, and they may have mild, moderate, or severe disease. So it's really important to partner with veterinarians to figure out how we should work these patients up, and which patients have mild disease and don't need any treatment versus the same dog that has no signs could be harboring really significant disease and, would benefit from medications. For cats, its most common heart disease is hypertrophic cardiomyopathy. And again, this is incredibly common, way more common than seen in human medicine. In fact, 1 in 4 Maine Coons or Sphinx or Ragdolls have this out there.
Oh.
And the prevalence out in general population is about 15% of cats. So
Wow.
It's really prevalent, but it's also sneaky and hard to diagnose. We may get the tip off that maybe the doctor heard a murmur or a gallop heart sound. And then it's again that fact-finding mission of doing the workup, and that really does often require the echocardiogram.
Absolutely. That one is super hard to diagnose, and sometimes it doesn't even come with a murmur. So
Exactly.
Very difficult. So when would a client bring a pet to a cardiologist or a veterinarian refer a patient to you?
Well, sometimes it's as simple as they hear an abnormal heart sound like a murmur or an irregular heartbeat. Maybe they're wanting to do a dental procedure with anesthesia, and they're wanting to make sure the animal is not compromised with severe heart disease. Other times, these animals are displaying real abnormalities that are impacting their quality of life. They may be coughing a lot or working hard to breathe, and maybe they're really tired or collapsing or fainting. So we have 2 very different kind of patients. We see those that are stable, and we need to assess their problems to get a good assessment for whether they could benefit from treatment long-term. And then we have the more urgent patients that need a more timely assessment because they're struggling.
Mm-hmm.
And even those patients, we can still help and improve their quality of life with medications.
So how do you partner with the primary care veterinarian for these patients?
Yeah, luckily, I have a great coordinator that is very accessible.
Mm-hmm.
So we often are booked. We do hold, appointments from cancellations for those more urgent needs of fit-ins. Oftentimes, if the veterinarian is worried then they need to reach out to us and we will find spots for them.
Mm-hmm.
We also work with emergency in case we can't see them directly, but we can help get the animal in if they're really unstable and then work with the emergency team. For the more stable patients, oftentimes a veterinarian may ask me, whether we should do anything while awaiting the referral. So it's communications and really just making sure we've exchanged information as best as we can. Lovely digital radiographs and digital records make things really efficient.
Yeah, absolutely. Absolutely. So what are some emergency signs of heart disease that somebody would want to have their pet seen really immediately for those?
It's all about the breathing.
Okay.
And if they are distressed and they are restless and can't lie down and they're stretching their neck out to breathe and they're breathing with their belly and they're pushing and pulling and they're coughing all the time, those are big problems that can't wait. Or collapse and fainting. Those are other really severe problems that need to be addressed urgently. And that actually is seen both. The breathing difficulty is a problem in both cats and dogs, whereas we don't see as many collapsing cats as we would dogs.
So what are some of the new developments in the field of veterinary cardiology?
Something that's new that I think we'll be seeing more of is a new device called the mitral clip that really they've been working a lot on at Colorado State, but they're also training other services throughout the country that have a surgeon and a cardiologist, where it's a alternative to open heart surgery and mitral valve repair.
Okay.
Because the open heart surgery and mitral valve repair in dogs is less available, is very expensive, it's very challenging and hard on the animal.
Mm-hmm.
Whereas this procedure is a hybrid procedure that is done on the beating heart. So
Wow.
It would be a small thoracotomy where we have a surgeon that would expose a little part of the ventricle, the apex of it, and then using real-time X-ray or fluoroscopy and transesophageal echo, which is an echo that is in a probe right on top of the heart down the esophagus in an anesthetized animal. They would then place with a catheter right up through the ventricle a clip that actually clips the abnormal mitral valve together so it doesn't flail and leak as much. And this is a procedure that would be done still fairly tertiary level referral centers, and some different cardiology centers that are not academic may be learning it too. So I think that we'll have to see long-term outcomes, but short-term, it looks pretty promising. So I think we'll be seeing more on that. And there's always going to be more discoveries with different medications and indications for, I think heart failure is a big area of research.
I'm going to shift just a little bit because now I'd like to hear more about our new State of the Heart, I'll call it State of the Heart 2.0 educational series that's launching for VCA Associates on Wolf University. You were involved in the original State of the Heart and you have led the project for the update. So tell me a little bit about the original State of the Heart and what is there to look forward to with the new series that's coming out.
Well, time sure does fly. I can't believe it's been 10 years. And
yeah, I know.
A lot changes. And we knew that there were discoveries made that we needed to implement. The original series was quite an undertaking. We had 4 different cardiologists and we had 4 modules. We devised general practitioner tools, different forms, and helpful tips and tools for technicians and staff, and really focused on the idea that this is not just for the doctors to know about cardiology. It's how to have a comprehensive, effective practice that, when we're managing cardiac patients at all levels, including, the customer service representatives, coordinators, technicians, and doctors, because as we said, it takes a team.
Right.
And so now what we're doing is we're not only updating information with new discoveries, something as we take for granted now that everyone knows that we use pemobendin in stage B2 mitral valve disease. Well, that wasn't out there at the time of the first state of the heart. So you have to realize it feels like it's been around forever, but it is new. We're also really looking at a different, more interactive platform.
Okay.
So a different experience where the first was more of a webinar-based PowerPoint lectures. This is more of an interactive experience that the user can have. We still will focus on the first modules being really applicable to all levels of a veterinary team. We talk about history and physical exam, heart sounds, videos of animals with breathing difficulty, and then really important common testing, diagnostic testing. And then from there, we dig into more of the cardiology details with subsequent models.
Uh-huh.
One really exciting addition that I've been waiting for is feline. And I know this was important for you too. And I loved it when you said, we've got to do cats. I said, please, let's do cats.
Yep.
So that's a big one. We have two models on feline that is brand new. So very excited about that.
When the previous edition was released, was the cardiac disease staging system in existence then? Because I know it's more widely used now.
Yeah, I think it was in its infancy. I think it had been fairly recently discussed, but I think it's way more established now. And it makes talking about heart disease between generalists and cardiologists much easier and streamlined. So I think that it was around and we discussed it, but now it's really mainstay.
This was a really big project to work on. What was your favorite part?
I would say the most fun was when we got to make our video shoot. We had the crew come up.
I heard that was amazing and very well organized.
Yeah, we want to make good use of time for the whole crew. We had the video crew. Mm-hmm. We had aligned what we thought were the perfect patients. I can't say that my cat ultimately was perfect, but as we're discussing how to handle cats and medicate, if they are hissing, mm-hmm. This is an important part of safety in handling that he was able to contribute.
True.
But we had a great time. We wanted to make videos. These are some simple thoughts about, how do you medicate an animal? And you would think this stuff is out there, but they're really fundamental basics that if a client can't medicate, then in cardiology, we are going to fail.
Right. Absolutely.
We wanted tools for not only clients, but for veterinary technicians, for really helping them learn how to do a blood pressure or an EKG or radiographs. And so it was really fun to be able to do these video shoots. The other part that I enjoyed was when I'm putting together a module, I am thinking about what discoveries are out there and what's new information that really resonates with general practitioners and really improves their ability to care for these patients. And so I do a really thorough literature review and I start digging into things. And it's nice to have the VCA library that we can use for that because I'm looking up studies and beyond that, linking to other studies. And so I think that discovery is also enjoyable for me. But definitely the monthly meetings were fun too with the knowledge and learning crew because we would kind of update each other and look at the timeline. And initially there was a long timeline and now we're just about there.
They're almost crossing the finish line. I don't think people realize our knowledge and learning department does a tremendous job. Actually, their name has changed recently to knowledge and capability development, but I'm still going to call them knowledge and learning. I don't think people realize how long it takes both to conceive of and to build and produce the educational content. And it seems that we started talking about this project 2 years ago, right?
Yeah, we talked about it and then we officially implemented it last March. And we've gone through a lot of support, help from Knowledge and Learning. And we landed upon, and I will shout out, Bryn Hogan has championed this project. And she has followed through and is so pivotal and essential for the production of this project. And honestly, I had no idea currently how many levels of review and how much time it takes for this integrated user experience that you see as a click of a button. It's quite incredible, the layers of building and checking and alpha, beta, gold reviews that are going into this to make sure we've got the best product we can give.
Kristin, we're about at the end of our time. It has been absolutely wonderful to speak with you today. Do you have any closing words for any aspiring veterinary cardiologists that may be listening in?
I would say that you are picking an incredible field to be interested in. It's very fulfilling. It can be stressful, but very exciting, and look for opportunities to get involved. Obviously, you're going to work very hard in school, but don't forget yourself, your self-care, because we're so focused on the end result of attaining maybe an internship or a residency that we may pass by opportunities that really the time is of the essence to enjoy on the way. Take a pit stop. If something arises with a really incredible opportunity and it wasn't on your ultimate plan, it might be a great detour for the moment. Professionally, I think it helps to be balanced and learn about different kinds of medicine. So be open to opportunities and take good care of yourself and your health and well-being.
Well, that is wonderful advice, and it has been wonderful to speak with you. Thank you so much for joining me today. I know that our listeners are going to get a lot out of our conversation.
Thank you so much, Dr. Kerl.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.